Hi everyone, welcome to Basically Brain. Today we're going to talk about the neuroscience of fatigue. Why do we get tired beyond understanding? Why do we get so exhausted that we are unable to move or unable to think, unable to talk? Why does this happen? Millions of people struggle with fatigue every day, and probably you do too. Sometimes it's the cause and sometimes it's the result of underlying problems in our lives. So let's try to understand what exactly happens in our brains, in our bodies, and in our behavior when we are fatigued. In today's chapter, we will be learning about identification of fatigue, causes, types, what cytokines are, and what does recovery from fatigue look like. For the human model of understanding fatigue and establishing a functional definition, scientists have narrowed down 7 key symptoms when it comes to acute fatigue. It starts with a subjective definition that is collected via a self-report, but apart from that, we can narrow them down to physical sensations like exhaustion, decreased energy, weakness, unrelieved by stress, not proportional to the activity that we did before. It's very unpredictable, and its impact on functioning can be identified with decreased capacity for work, decreased quality of life, difficulty completing tasks, poor sleep quality, withdrawal from activities. A key symptom would be unpleasant emotions like helplessness, vulnerability, distress, impatience, anxiety, emotional numbness. If you look at how it affects our cognition, you can see decreased cognitive ability, decreased attention, concentration, motivation, memory deficits, and overall decreased mental capacity. It's quite pervasive, chronic, and it's unpredictably episodic. Even a small combination of all these symptoms can create a havoc in someone's life, and sometimes all of them are present at once, creating a significant paralysis of such a person's overall health. So whenever clinical interventions are required, at that time, the first thing that you look at is the causes. What is causing such level of fatigue in this person? And the primary causes that have been identified by researchers so far include stress, autoimmune disorders, infections, flu, anemia, malnutrition, chronic pain, sleep disorders, hyperthyroidism, and centrally acting drugs. They should be reviewed because clinicians will have to investigate to determine if there are any causal factors that can be identified, because what that does is that gives us a path to follow. Say for example, somebody has multiple sclerosis. Their immune system is attacking the myelin sheath of their neurons. This is a very high energy consuming process, and obviously alongside with all the other issues that this patient has, they will be struggling with a huge energy drain on a daily basis, and fatigue with multiple sclerosis is a very common symptom. So when the treatment of multiple sclerosis begins, their fatigue can be managed alongside the MS. Similarly, if somebody is anemic and that is causing their fatigue, what the clinician needs to address first is their anemia and improving their hemoglobin levels. That is how the treatment will begin. So what happens inside our brains when we are fatigued? In the context of neural mechanisms of fatigue, it can be organized into 2 main types: central fatigue and peripheral fatigue. Central fatigue is our inability to initiate action. What is exactly that's happening here? Our brain tells our body that you're not going to move. The central nervous system is giving this command out. Why is it doing that? Central fatigue impacts our motivation and initiation of physical activity. It happens in healthy adults after long sessions of exercise due to neurochemical changes in their brain. What are these neurochemicals that literally stop us from moving? They are serotonin, dopamine, and norepinephrine. What exactly happens is that their concentration around our synapses changes, and this impacts the brain and the spinal cord, which leads to an inability to initiate muscular activity. You know you want to move, but you just cannot. Central fatigue also impacts our cognition, where normal decision making feels extremely strenuous. Like even deciding what you want for dinner can feel like a huge burden. Now, coming to peripheral fatigue, it happens in the parts of the body that have used up all their energy reserves. For example, when you go for a hike, without warming up for the first time, and then you can't feel your legs afterwards, that is an example of peripheral fatigue. And you can't stand up, you can't feel your legs, that's peripheral fatigue, where your legs have used up all their energy reserves. See, the parts of your body have certain force generating capacities to exert force with the help of your muscular and your skeletal structures. If I hold this cube up in my hand, I am actually exerting force to lift it up against the force of gravity. I can hold it in my hand for 50 seconds without a problem, but I cannot hold it in my hand for 5 hours without running out of energy. You may not notice this, but mobility and physical functions happen due to a lot of calculations that your body does constantly throughout your waking hours, and probably when you're sleeping as well. Like, your arms use muscles and bones to deliver a slap or a punch, and your brain calculates the angle at which you need to throw the slap at. But if you're not a very physically active person and you're sent for a boxing session for 3 hours, it's very likely that you will not be able to lift your hand at all after that session until you give it enough time for rest and recovery. In both central and peripheral fatigue, it can go away after appropriate treatments and resting. But if we're looking at fatigue, we must look at what chronic fatigue syndrome is. It is defined by the excruciating fatigue experienced for more than 6 months when all the above cases are ruled out. So how do we detect chronic fatigue syndrome? It involves the nervous system, the endocrine system, and the immune system. Once we have ruled out every other cause, and the patient consistently complains of fatigue and it has been going on for over 6 months, we may start looking into chronic fatigue syndrome and test the patient for the production of cytokines. Now, what are cytokines? I mentioned them in the beginning of the video. These are small soluble proteins that our cells use to communicate with each other. Cytokines are released when our immune cells are activated and inflamed in such a way that they impact our central nervous system to regulate our fatigue and energy levels. This can result in flu-like symptoms and extreme exhaustion that results in burning of energy levels faster than normal. When researchers gave anti-cytokine treatment to test subjects struggling with fatigue, they showed signs of recovery from flu and the infections. Several studies have found activated T lymphocytes, which means that the immune system is being hyperactive, and a very high percentage of cytokine release is seen in patients that get diagnosed with CFS. There's literally no other way of diagnosing CFS, because one of the main issues with this is that it's very hard to diagnose. So how can we treat fatigue or acute fatigue? It can be pretty straightforward if we're able to identify the cause, but apart from that, there's a mix and match of 4 sets of treatments that play a key role in overcoming fatigue and starting the journey towards treatment and having a healthy, proactive life, and just setting yourself free from the shackles of extreme exhaustion and acute fatigue. First, let's talk about psychostimulants. Psychostimulants are drugs that activate your central nervous system, and they introduce a sense of wakefulness and reduce the symptoms of lethargy and tiredness. This will be at the clinician's prerogative and is primarily used for cancer-related fatigue. So the class of psychostimulants that are used for the treatment of fatigue are dopamine agonists, which means that they mimic the function of dopamine in our brain when the supply of dopamine is low. The second intervention plan for the treatment of fatigue would be exercise. Yes, it will be anaerobic or aerobic exercise that really helps along with relaxation techniques. Getting into the habit of exercising doesn't only reduce fatigue but also increases neuroplasticity. It increases the plasticity of various neurotransmitter systems. I mean, yes, you do increase your capacity to tolerate more force and utilize your energy reserves better, but you also train your central nervous system to initiate muscular and skeletal activity with much more ease and less resistance. The third type of treatment, which is very successful in helping patients with fatigue, is cognitive behavioral therapy, also known as CBT, primarily used for patients with multiple sclerosis. With CBT, therapists help patients change their perspective, their negative thoughts about fatigue, and approach it with a solution-oriented mindset. You can learn to understand your fatigue and manage it while increasing your energy reserves. CBT mainly involves discussing and evaluating the consequences of your fatigue management strategy. what happens if you manage it well and what happens if you don't. A very promising scope for treatment is also seen in nutritional interventions, but it's important to understand that diet alone cannot really help with fatigue. You really need to train your central nervous system for more physical activity through aerobic and anaerobic exercises. Scientifically, that is the most successful intervention design so far for treating fatigue. Where it comes to nutrition, we have some studies that show that increase in iron intake can help, but not really in women that burn a lot of calories, that are athletes. Iron doesn't really help to treat fatigue in those cases. So there, a more holistic approach is needed, which covers your training, your diet, your sleep habits, and you have to check for underlying depression as well. We need to understand that our bodies are energy systems, and the energy burned cannot be just compensated with supplements or diet. We actually need to put the muscles that we have on our body into use. The protein that we eat is used to build the muscles. The carbs that we take in used to transform the energy in our body for various functions. So once we understand our bodies as an energy system, we think about the perpetual motion engine, which once you start it runs on its own. Our energy reserves are not like that, but muscular activity is quite like that. If you get into the habit of moving around a lot, running a lot, your body will be able to move around a lot more, and your body will be able to run a lot more. But it's really dependent on training. You will have to work with your clinician, you will have to work with your psychotherapist, and the main focus here should be increased physical activity that can actually break patterns of episodes of chronic fatigue in people that are not suffering from cancer or multiple sclerosis or depression or anemia. And for them, increased physical activity has proven to be a very successful plan of treatment. So that's it from me for this week, and I hope you enjoyed this as much as I did, and I'll see you next week.